So students, we're getting ready to start a new unit in Fundamentals of Therapeutic Massage. And we start with chapter 5. So let's share the screen. And here is our wonderful book. And of course, I have to get my glasses on and make sure that I look good. All right, so we have done Unit 1. So there were 4 chapters there. And now we're getting ready to do Unit 2. So with Unit 2 now, we have 3 chapters. And this unit is setting the stage for you to understand the benefits of massage, the indications for massage, the contraindications for massage, how research literacy fits into all of that. And then the last chapter is on hygiene, safety, and sanitation. So let's click on to chapter 5 and collapse the table of contents. Remember, you've got all of your fundamentals resources on the Evolve site, along with your chapter test, the big long one that you have to do that goes into your grade book. And also the answers and rationales for the end of chapter review questions. So as we look at this idea of research literacy, and we take an overview of the chapter by looking at the chapter outline, there's some interesting concepts right here at the very beginning about massage as an art and a science. So one is not exclusive of the other. And sometimes people think that just because we focus in a scientific approach and a scientific way of understanding, that negates the intuitive, artful aspect of massage application, and it doesn't. In fact, one informs the other. We have previously talked about evidence-informed massage therapy practice, and we'll spend a little bit more time with bias and correlation and causation in the research process. So the focus is not to teach you how to be a researcher. The focus of the chapter is for you to find and be able to read through research in a way that you can use the information as part of your critical thinking process and massage application. So this part of the textbook is a general information, and it really is good for you to know, but it is unlikely that the language or the concepts will be a specific question showing up on the MBLEX exam. Once we get into the current research overview, though, the information, the concepts, maybe not the exact words, but the concepts, a little less vocabulary, more concept understanding comes into play here. And then we start to take the research here and translate it, take it from a scientific journal. We're going to use PubMed, for example. It's a peer-reviewed database. And then take it into what can I confidently say as a massage therapist in terms of benefits and mechanisms of action. That's what this part is. So Here are your objectives. And you would, you want to question yourself with this. Can I explain evidence-informed practice? Can I use levels of evidence guidelines when I am looking something up to decide if it's a good piece of information or maybe not? Can I find and cite current research? And then explain the effects of therapeutic massage in physiological terms. This is the area here, the chapter 7 objective, that will be most likely tested on the MBLEX exam. All right, you know the drill on key terms. And this is the general overview to the chapter here. It connects the previous content to what we're going to be discussing now. So here's that concept of massage as an art and a science. And we want to honor the idea of intuition and the importance of mindfulness. But we also want to also gauge what we are thinking about and doing in terms of biological plausibility. So biological plausibility is the existence of a physiological mechanism. It may not be proven yet, but there is at least an existence of a physiological mechanism that may explain a cause and effect, that's causation, relationship. So then there's an example here. Is biologically plausible that mechanical force applied during massage may support movement of interstitial, that's the fluid around the cells, into lymph capillaries. That is not solidly proven by research, but it's biologically plausible. That's an example of what that is. To appreciate biologically plausible mechanisms, you have to understand how the body functions normally. How would it normally move interstitial fluid into the lymphatic capillaries? How does that happen normally? And then, can massage application be adapted to mimic normal? Here is a claim that is not biologically plausible, that extremely light touch with one finger on the bottom of the feet can change thyroid function. And you'll hear people say things like that, but if you go back and you critically think about it, you're going to identify that there isn't a logical pathway through this concept of how does the body maintain homeostasis and function normally, typically. It's too far of a leap to make that kind of a claim. Now, I would never say that there is this would be a claim that might be made in a reflexology or specific type of point system on the foot, hands, and other places on the body. I'm not going to say, especially if there is a long historical, cultural interface, I'm not going to say that there's no validity in that approach. But I'm also not going to say that it has been proven. So I would wait and see. I would wait and see. All right. We have discussed evidence-informed massage therapy practice before, and the context here is how it fits in with our confidence level and how we explain and justify the appropriateness and the benefits of massage. So, and then we also want to be, not skeptical, but we also want to, not just believe it because somebody says it. So these points right here, what should be done when there are different levels of evidence or changes in the evidence? And this has happened a lot with massage. We used to think, and now we know that it's not that, and it may be something else. And there is a limit to evidence. There's always that outside of the realm that we can't truly capture, but may be able to be captured with an increase in technology in the future. The interstitium that is talked about in the science book it's always been there, but it was a relatively new awareness because the technology had changed, and it changed how manual therapists, including massage therapists, looked at some of the work they did, as well as how the fluid is exchanged in the body. And then what should we do when there just is no scientific evidence? And I mentioned a little earlier that, we want to acknowledge that, but we also want to acknowledge the consistent, multicultural legacies that come forward if there's a sustaining power in that information, such as foot massage, um, and how it may affect the whole body. Then we don't want to just discount it either. And then what do we do if the studies produce conflicting evidence? Well, you compare and contrast both. You don't ignore stuff like that. You don't just pick the research that's going to support what you believe. It's okay if there's conflicting information. So one of the things that the scientific method does is tries to reduce bias, which is a tendency toward a preconceived belief. And that is why it's important for research to also be peer reviewed by subject matter experts as well as replicated, to see if another group can do the experiment uh, and get the same result or a similar result. So there are common types of bias in research, and it shows up in how we believe about things as well. Participation bias occurs when participants react the way they think the researcher wants them to. An example in a client interaction would be if you ask them to move their arm, they will try to do it the way you expect them to, or after you have done something with it and you do a post assessment and you have them move their arm, they're going to want to try to perform in a certain way. Selection bias is an experimental error that occurs when the participant pool or the subsequent data does not represent the target population. So we've got a problem with that outside of the scientific world in people indicating their level of success in working with clients, but they are selective about which clients they choose to work with. So with that selection bias being in place, that means that their reported success in helping clients is not accurate because they're not selecting from the larger pool. So that can be a real problem. And you'll hear it again outside the research thing and stuff called select your ideal client, or only work with clients that you know that you are able to help, and so forth. And then confirmation bias occurs when a researcher forms the question, the hypothesis, or the belief, and uses the information to confirm that belief. You're not going to look at other options. And that skews how you interpret your research. So if you're too hooked on what you think is going to happen and you're not open to other possibilities, you have decided in your head that massage is going to increase the range of motion of the shoulder, then you're likely not to be open to other possibilities that may occur. So you want to watch for these things. Here it talks about PubMed as a free search engine, and it gives you information about what the importance is in a peer-reviewed scientific journal. You don't want to believe everything you read. You need to be careful of anecdotal reports. Is a subject matter expert or professional opinion. If there's a consensus among a bunch of experts, then that can fall into part of an evidence-informed practice. But if it's just one person, maybe not, maybe not. And then we have talked before about correlation and causation. Correlation is not evidence-informed. And a lot of the anecdotal type stuff, or I did this thing and it helped, or here's how I did that and here was the result, that's more of a correlation. And we got a lot of that in massage, so don't fall for that. You want to look for causation. And that's what an experiment, a scientific experiment, is supposed to do. So here is the segment here that is talking about how to find and critique and then use research. So to do that, you have to have a little bit of an understanding of research in general. You will, I'm not presenting this to teach you to be a researcher other than literature research. You look at all these papers and you perform a literature research as you're trying to learn something or justify something. Now, that doesn't mean that at some time you might want to move forward and actually do some more formal research. And it's the Massage Therapy Foundation that is involved with that. So that if that's an interest to you, you might want to pursue looking at what they have. So literature search and literature review, you've got to be able to ask a concise question. So you got to begin by identifying your search parameters. And then you got to decide where you're going to research. And I want to encourage you to utilize and explore your local library. The librarians can be a tremendous help in helping you with a research process. And you have to kind of find the right terms that lead you to what you want. And then there are ways that you can save that research. Now, there are artificial intelligence programs now that will data mine and go through a bunch of, if you put in a collection of search terms, they'll go through and data mine that and even do a comparison and contrast amongst the papers that are found. And Luke and I have always done that ourselves, which is a really in-depth and tedious process. In the future, when I write papers or write textbooks, I will make use of those artificial intelligence programs to do the preliminary research for me. But it still will be my responsibility to look at each article and decide if it's relevant and make sure that it is done in a way that is valid. A lot of times with trying to narrow down that research study, an acronym here, a PICO strategy will be used. And that's patient and problem. So it doesn't sort of fit with us because we use the word client a lot. But intervention, comparison, and outcome, it's a way of developing a narrow, concise research topic to put into PubMed. And I gave you an example here. And then we just talk about how the internet is used for research. And I do use Google Scholar, but it is not as rigorous in terms of peer review as PubMed. And there are others that are valid, but learn to use PubMed first. And then this gives you a link to it, and it gives you some ideas and talks about Boolean logic, or how to narrow the search with and or not. And then it also gives you a link to the Cochrane organization that provides what's called a meta-analysis. They do an excellent job of taking a bunch of research and on a specific topic and then pulling it together in a certain way. And that's a very high level of research. They also have a feature for that where they take it into a plain language, to get away from some of the scientific jargon and get into a plain language interpretation, which is fun and helpful. And artificial intelligence is starting to do that as well. So here's a box about developing a helpful and reliable research question for a literature review. So these are the various forms of research, and it's nice to have a general overview on this. The Massage Therapy Foundation actually has a case report contest, and you may want to explore that in the future. So the guidelines for levels of evidence is that you want the highest level that you can. And so a level A, this is one that has gone through a lot of rigor in its development. So it's a well-conducted random controlled studies with 100 or more participants. And the new guidelines with research is that it is supposed to have the level of evidence, the confidence level here. So when you're looking at evidence, especially more recent, you should be able to see level A, level B, level C, or it can be good, fair, or poor. What you want to look at first is to see if there are any systematic reviews or meta-analyses. And so this section right here is how research is conducted. And this is a box about the case reports I mentioned earlier. Some background here. This is good to know, will not likely show up on the NBLEX exam. And so as we scroll, and there's also a lot of ethical behavior required in research. And there are oversight boards with that, specifically in human research, but also all kinds of animal-based research. You have to go through what's called a institutional review board, an IRB, or an ERC, or an ethical review board. You may hear these topics. So here's research in plain language, which falls into, as I have described before, falls into our critical thinking process and into how we actually can formulate how we're going to do our documentation process with clients. So define the question, and then here's the examples that we're going through with this. Then you got to locate resources, and then you form your hypothesis. This is what you think is going to happen. This is your educated guess. And then you develop your experiment, which if you're using this as a platform for massage care plan development, this would be the implementation of the actual massage application. And then you collect your data. This happens afterwards. Did it work? Did it not work? Where, were there things that occurred that we hadn't anticipated? And then how you would report that and bring that forward so that it's understandable by other people. So that is kind of the overview of how a research is conducted. The reading and interpreting a research paper now is more relevant for how you are going to grow as a massage professional. So the guidelines here are a little bit more about what makes research valid and usable and something that you can have a level of trust in or confidence in. So here's a little framework. One of my peers pulled this together, and Glenn Hemel did the kind of put this together. Very interesting character. Added, I always want to acknowledge him. He added a lot to this. And again, here's this idea of log into PubMed and see what you can find and play around with the content that is there. So there's an introduction, and then it talks about the methods. How did they do research, which is important if there's going to be a replication of it. And then what the results were and what the discussion is. I lots of times will read the introduction and then go to the discussion, and then looking at what the conclusion is. So here's kind of a little checklist about how you would do that. Now so now we're getting into where the information is directly relevant to massage and why you might not be identifying or have an NBLEX question that would specifically cite or reference a piece of research. The concepts involved in the current research overview will help you with your critical thinking process in how you would address that particular question. But even more important is how you're going to become your own best teacher by staying current with research and using critical thinking skills to guide your interaction and the decisions you make as a massage therapist and how you adapt and apply massage. So, like I had said before, when I do this the next time around, I will use one of the artificial intelligence programs to data mine. But this is something that I have always done myself. So, like I had again said previously, it takes a lot of time. And so I looked at all the different databases and used these various search terms. And I'm confident, I have a high confidence level of the information that is presented. So here is, I actually, this mentoring tip talks about what that process is like. So first and foremost, we have to consider safety. And that is the first criteria you look at when you're making any decision about the application of massage therapy. And generally, massage is safe if it is not aggressive and in certain areas like the anterior neck. You don't want to apply a lot of pressure in the anterior neck, etc. But you've got to make good decisions about this. So we can have side effects and adverse effects. If you work too aggressively in an area and it's tender the next day and it interferes with a person's activities that day, that's a side effect and an adverse effect. Okay, so here are the research papers that I had cited over the years, and you can see a legacy here of research. And if you click on these, it'll take you to the reference at the end of the chapter. But it's kind of fun to take that reference and plug it into PubMed and see if when you read the whole paper, look at the whole paper, did I interpret it well? Did I interpret it without bias? I tried, but humans bias things. And so that's why we need to accurately list the research so somebody can go back and fact check us. Fact checking is important. And if somebody does find an area where there's a discrepancy, then you should be open to understanding and correct. Okay. Justifying the outcomes for relaxation, stress management, pain management, and functional mobility. This is our wheelhouse. This is the area where we really function effectively with massage therapy application. And particularly in pain management and functional mobility, it is where research becomes important as part of how we justify our position when we're discussing with another healthcare professional. But for all of these, and what you're going to find is that the outcomes that have been most researched and have the most quality evidence are relaxation, well-being, stress management. Next on the list is pain management, and the least amount, it's there, but the least amount is the claims that are made for functional mobility, which is range of motion or a muscle skeletal dysfunction or something like that. So this is something you're going to want to narrow down and really pay attention. It will help you for a very long time in lots of different environments to explain and justify the benefits of massage. So here, how this is organized is that here's the outcome, here's the definition, here's the main goal that is involved in the areas that are targeted, and then the research evidence supporting this claim. And so when you go through this, you will find that there is some research that goes back, like this one here. This is not too old, but it's 2014. And when I was updating this, I found that a similar group had done research. That's what NL means, is that there's a group there, had updated and published in 2022. And then again, here's a string of research, but it is remains current still with research that was published in 2021. So you want to rely on research that is no older than 10 years, unless you're trying to get a legacy string going. But you don't want to, you don't want to have a validation statement or a justification statement with research that's 35, 40 years old. And there hasn't been any updating since then. The technology is so much different now than it was 25 years ago, 10 years ago, 5 years ago, that we really need to take a look at the most current research, because it may show that what we thought is no longer the case. Or you get a string like this, supporting relaxation in acute care situations, supporting recovery through a palliative care that has a long string of support that has been consistent over time. Then the way this is put together is the highest level of research are systematic reviews and meta-analyses. And so it was important to me as I wrote this book that I was able to support the statement that an evidence-informed outcome for massage relative to relaxation is supported by systematic reviews. And when I do this, what I found is that the research has slowed down, has really slowed down in justifying massage, and a lot of it is coming more from other countries. And so I may not have been able to find a brand new current systematic review, but if you take this, if you copied and pasted this and put it into a search program like on PubMed, you might be, or in Google Scholar, you might be able to see where this article has been cited for a more current research process. So the newest one I found in here that was a systematic review was 2021. So that's pretty good. So outcome for stress management's got the same pattern to it, a general discussion, and then the evidence that supports it, and then the systematic reviews. And this one, there I was able to find some very current research around this. All right, and quite a lot of research. So good support for massage therapy and stress management. So what I've done is opened up PubMed and I copied one of the systematic reviews for stress management, and I'm going to paste that in here, and I am going to search. And so here is the study that comes up, and I can read the whole study here with the figures. And then here are similar articles that I can go and look at. And then if it has been cited, if it was cited by something, that means that research has to be more current. It used the research. Therefore, if I look at cited by, I may be able then to find even more current research than that one that is in the textbook. So as I go down here and look at these more current research papers, I'm not sure that there is anything here that would give me more information or more current information relative to the effects of massage and stress management. But that's how you find it, that's an example of how you can do that. So in this particular, it's massage therapy in children with asthma that was published in 2017, a systematic review and meta-analysis. If you go down to the conclusion here, all studies have shown that massage therapy has a significantly positive effect on children with asthma. If I, over here, I could also go through and click on some of these things here. Cited by would be the same as what we are looking through down here. Here's another pediatric massage for treatment of acute diarrhea in children, a meta-analysis. But if it's being used to support a position in a quality article, even though it is not taking you right to an article that is in the same vein, massage and stress management, the authors are still seeing that there is relevance in that content. So, all right. Okay, so here we are. That's the study that I copied and pasted out. But it's really easy to do, to double check and confirm and see if there are more recent studies. So here's our outcome of pain management, an overview of what we're generally talking about, and we've discussed multiple times in this textbook as well as Essential Science, pain pathways, pain function, and massage interface in a non-pharmacological treatment strategy for symptom management of pain. And then here's the general research evidence, and there's been quite a lot of newer research available since this was written. Now, this textbook was turned in for publication in 2023. So it's 2024 now. That's the issue, is that this information, while current, is still going to lag. And that's why it's important for you to go check and see if there's anything more current. And then here are the systematic reviews. And so I can say with confidence, although there hasn't been a systematic review that I found when I was writing this chapter in a while, if we were to go, take that back. Here's a 2023 study on pain management and with people that have been burned. So, and as you know, you go through and look, and here's another 2022 study. And then this is our last evidence-informed outcome. This is mobility. It talks about, what it is and what it means. So we typically connect quality of life with the ability to move around easily in our environment. That's generally what we're looking at here. And massage does help that. Absolutely. But the research isn't as robust on how that occurs. And it may occur because we're interfacing with one of the other outcomes, like stress management or pain management. So here's the discussion and the research. And as we go through, what we're talking a little bit about why that may be, and tensegrity and mechanical forces deforming soft tissue and so forth. Here's a schematic that's talking about how massage may help smoothing out or spreading around the hyaluronic lubricating fluid between tissue layers so it slides better. And then we get to our systematic reviews. So if I want to, here's the summary on this, and then we're going to get into a new area. If I want to have a justifiable conversation with somebody, the way that content I just went over with you is worded is kind of the language I would use. And if I have to write a narrative, if let's say you want to work in a pain management clinic, let's say you want to do that. Or let's say that you want to do a marketing strategy that's really going to target the importance of relaxation and well-being as a evidence-informed outcome. This section here gives you a lot of the wording and a really good start on where you would go with the research. And then I gave you a quick example of how you can update even what's here in the book. All right, share screen again. So this content has to do with how you are going to think about your treatment planning and your, in some ways, your documentation, and how you are going to critically think about a care plan for a client, and what is biologically plausible and you can have a confidence level in. So you've seen this before, but let's do it again. Here are the 4 main outcomes. We just talked about that. Here are the 4 main approaches to care, and we'll get to that in the next chapter. This is how we apply a mechanical force. Here are the massage methods used to push and pull. That's chapter 10. You're already learning this language. Here are the 12 modifiers on how we can adapt and make the massage specifically unique to the client for the outcome we're trying to generate. These are the stresses. This is what when we do these things, when we push or pull using these methods and modify it, what we have done is we've loaded the tissue that creates a stress in the tissue. And then that is what finally triggers the mechanotransduction or the neurotransduction or a combination of both into to generate an adaptation response. The other thing when we look at physiological effects that we want to remember the ethics on this, and also that this is a network. Everything affects everything, even though this is going to be separated out a little bit. You can't separate neuroendocrine influences from circulation and how it is going to affect a person's perception of their world at that moment. It is not, it's a unifying sort of thing that's dynamic. Okay. This is a really fun proficiency exercise. Review the chapter outline and reflect on the content of the chapter. Pretend you have graduated and are developing a concise informational piece about the benefits of massage. What information in this chapter would you include? And then, make it be about 100 words, no more than 500. The challenge to be concise really helps you understand what's going on. All right, so as we go through the content here and sets the stage with the overview, the National Centers for Complementary and Integrative Health have some new research strategies that are involved in whole person care, and that's that biopsychosocial influence. So the first one we just talked about was the biopsychosocial model. And then we're getting into the idea here of the neuroendocrine system. And of course, there's a tremendous overlap with your essential science studies here. This is more conversational and it's more concise. It's pulling a lot of the information together. Gives us a framework for how we would relax. Also, it acts as a review. It then becomes a retention strategy as well as a recall strategy. And down we go. And then there an intertwining thread through all of these biologically plausible evidence-informed processes is the breathing function, because it is a somatic voluntary response. We can control breathing, we can change breathing, we can pace it, but through the hypothalamus there is a direct connection with the autonomic nervous system and everything that goes there. So when the breathing gets distorted, there can be a lot of syndrome based, not pathology based necessarily, but syndrome based effects that the person is experiencing. And you'll want to slow down and pay attention to this. You can turn this into a questionnaire even, and this can inform the way you would question somebody. For example, I might say to somebody when I'm doing an intake, do you have a little bit of an irritable cough, or are you clearing your throat a lot? You know, you can notice that the person is sighing or yawning or sniffing. The good thing about recognizing the potential for breathing pattern disorder and how it's affecting the person is that massage can work very effectively in reducing a sympathetic dominance and mechanically to support the breathing function. So it's a solid place for intervention. Okay. This continues to go through the areas that we work with in the neuroendocrine arena. We've got neuromuscular mechanisms, hyperstimulation, analgesia. That's a big process where a person has got some discomfort. They've got an achy back. And when I massage the whole body, not just the back, that's a lot of stimulation going into the person's nervous system. So hyperstimulation, it masks, it overrides the discomfort. Counter irritation is similar. It actually is a form of hyperstimulation, but it acts more local. So if somebody has a burn scar that is itching and I massage over the area, I'm applying a different sensation. And the more novel, the more recent stimulation will at least temporarily override in that example, the itching. If somebody has sprained their ankle, I can do the same thing. I can apply an appropriately gentle massage around it, which is a novel sensation, and it wouldn't interfere with the healing at all. And it would help with the person's feelings of distress, at least temporarily. Things like thermal therapy and menthol-based ointments and rubs, gels, that sort of thing. They're a counter irritant. So there you go. And then also potentially the reduction of impingement. And impingement is where nerves and vessels don't have enough room. They're being pressed on. And that can be soft tissue related, it can be bone related. And where massage would come in is that we can increase the pliability in an area and maybe reduce that pressure on those nerves. So that's what's discussed here. So slow down and read this. This is going to overlap with your essential science studies as well. This is language you will encounter. All the different reflexes and that sort of thing. This is the stuff that is likely that we know with research or is biologically plausible that we are interfacing with massage therapy. These laws are kind of, fun. And they have an implication for massage. So that in addition to that, we also have the vestibular, the inner ear cerebellum complex, and the reflexes that are involved with that. So slow down and pay attention here. Um, a, a, um, a method of getting the body to activate a certain groups of muscles, for example, without having them actually to move it, is to either look at it, turn their eyes toward it, or turn their head toward it. These reflexes here, the pre-programmed process is that if we're looking that direction or our head is turning that direction, we're going to move in that direction. So here's hyperstimulation analgesia, and here's counter irritation, and then here's the nerve impingement. And for this one, you need to know where the nerves are at. So it's the most commonly, it's the plexus area of the brachial plexus, cervical plexus, brachial plexus, lumbar plexus, and sacral plexus, but it also can be along a peripheral nerve track. Here is our segment on circulation. And again, talks about it in general, looks at some research, gives you an overview of the anatomy and physiology that is being targeted. So if you're going to move fluid, you need to know, you need to be on the tubes where the fluid is at, for example. So the anatomy is important. And again, this is language that will show up in a variety of MBLEX licensing exam questions. So as you look at this is novel repetition from other content you have heard, and as well as information in your science book. So here are some key points. It's kind of fun about body fluids and the research. It's a little iffy, and but local effects are biologically plausible, and then a more systemic effect probably is more of an indirect response through homeostatic regulating functions through the nervous system and the endocrine system. And then here's cerebral spinal fluid. This is a nourishing fluid that eventually is cleansed through the venous return, and it's in the lymphatic system. It's located in the central nervous system primarily. The reason why there is a specific focus here is that there is an adaptive specialization approach called craniosacral therapy, and the research is a little iffy on it, but there is anecdotal ongoing, starting to show a trend over the many years. I learned it years and years ago, so not to be discounted, but the effects may not be working through this particular physiology, might not be directly affecting the craniosacral fluid, the cerebral spinal fluid, but this is a fluid. You've got your blood fluid, you got your interstitial fluid, you've got your lymph fluid, you got fluid also inside the cells. So if we're going to talk about fluid movement, then we have to be aware of all the different fluids. And then connective tissue. And this would be particularly targeted in a specific approach. Sometimes you would hear the term myofascial release. And just since, I think it was 2000, 1907 at Harvard, there was the first combined symposium on bench scientists studying connective tissue and manual therapists that were targeting connective tissue, and a meeting of the minds here on what that, and the research has continued. And I was excited to be a part of that initial symposium, but the information has also evolved. And it's an important target tissue, but it can't be separated from the other target tissues either. So here is information about connective tissue and fascia and the different types of fascia, and what it does. And there's also an overlap in this arena about trigger points, and whether they exist or not. My opinion, my absolutely biased opinion is that the referred pain patterns and the tender nodules can be a way of framing a process. So it's a way of looking at something. So again, you're going to want to read this. This is a narrative on the biological potential mechanisms for massage therapy. This gives you a way of discussing topics if you can learn to speak in a similar way as this is put forth to you. And then it talks about the variety, a little bit of the history and a variety of connective tissue methods. And here is a chart. This shows up in your Essential Science book as well. It's a diagram. It's where these various fascial systems, these sheets of connective tissue, tend to dive down. They create compartments. They create certain shape, but it dives down into the skeletal system. Mechanical forces in the body, from balance and movement and our own pushing a wheelbarrow or whatever we do, pulling, on a rope, where these tissues anchor into the skeletal system. And these then would be areas that we would concentrate on if we're trying to just generally support this linking fascial system. And so when I say focus on, it would be slow down, use methods like inhibitory pressure plus movement. These are good places to use an adjunct method of a suction decompression. Obviously, it's not going to work in the hair, but if you're wondering, cupping is the common term. If you're wondering where to put a suction cup, these are areas where there's a lot of crisscrossing of these connective tissue structures. So then we get to our foot in the door, ta-da, and our summary, and our learn more on the web, and there's links also on the Evolve site, and our referencing, and double check me, check it out. Go ahead and copy and paste this into PubMed. Lots of research here. Look at that. Well done, Sandy and Luke. Well done. And eventually we'll get to our multiple choice questions for discussion and review. Okay. Chapter 5. Interesting. I have to think, in order to write an academic textbook, Luke and I have to think through this kind of a lens. But we also think around the edges of it too, in terms of intuition and uh, ongoing indigenous cultures bringing forth sustaining theories and practices and the overlapping interfere in, you know, interlacing of thought into massage. And I hope you're as excited about it too. This is an ongoing study. This is something that you want to do on a regular basis, is go check out the research. Okay, next chapter is chapter 6. That's that indications, contraindications chapter.